COVID-19. We welcome amongst the panelists this morning Ms. Kanya Ndaki, a COVID-19 survivor, Mr. Michael Fonk, yes, from George Hospital, who will give us an account of how they have managed and battled with the various first, second wave, and now the third wave of COVID-19. We also have, I can see on the screen, Dr. Daniel Israel, a general practitioner from Johannesburg. I wish to take this opportunity to thank all South Africans for cooperating with government in the containment of COVID-19 pandemic. We know that it has been a very long journey, but the reality is that this battle is not yet over. The third wave remains stubbornly in our midst, with the resurgence moving decisively from Gauteng to the coastal provinces, with the Western Cape and KZN alternating each day in topping the daily infection rates. The Eastern Cape is lagging behind them, while the Northern Cape has never really subsided from second wave and just moved straight into the third wave. The worrying trend, fellow South Africans, is that overall, in the last 7 days, there has been an 18.2% increase in new infections over that 7-day period compared to the previous 7 days. So while the curve had started to show a downward trend, it is now picking up again, driven largely by the Western Cape, KZN, the Eastern Cape, but also the Northern Cape, as I've said, which has never really gone down from the second wave and just went straight into the third wave. Slightly encouraging, nevertheless, is that hospital admissions over the last 7 days have gone down by 5.4%, which is very encouraging because it means less pressure on our hospital facilities and our medical staff. It is for this reason that, fellow South Africans, the National Coronavirus Council and Cabinet this week have decided to keep the country at alert level 3. But we remain hopeful that if we all observe the known protocols, we can start to see a decisive flattening of the curve in the next 2 weeks. And this is all in our hands as government, but also as citizens. We have made some significant milestones in the rollout of COVID-19 vaccines. By yesterday, 5 p.m., we had reached 10,167,000 vaccinations, which have been doses which have been administered. This includes the second doses of a Pfizer vaccine. Just over 3 million people over the age of 60 years were either fully vaccinated or had received 1 dose of the Pfizer vaccine out of an estimated total population of 5.5 million of this population of the over 60s. Now, this gives us a coverage of the over 60s of 55%. But our wish is to reach 70% of the over 60s. So we still have some way to go. The total population which is fully vaccinated, either with a J&J 1 dose or with a 2 dose of Pfizer, now stands at 4.62 million people. These are people who are fully vaccinated, which is 12% of the adult population. But remembering that this, when we talk about adult population, we mean 18 years and above, but the 18 plus 34 had not yet come into a vaccination category. The total number of people with a minimum of at least 1 jab of Pfizer and also J&J, the people who have received either 1 jab or 2 jabs or Pfizer or J&J, in total is just under 8 million at 7.808 million, which means in terms of the adult population, those who have received at least 1 jab are 20% of the adult population. Again, I want to emphasize this: we have reached the 20% without admitting the 18 years and over, between 18 years and 34. We still have a long way to go, again, to reach 70% of the adult population, but at least we are somewhere on the journey, with 20% of all the adults between 18 years and above. As announced by Cabinet yesterday, we have indeed decided to bring forward the registration and vaccination of people over the age of 18 years from what we had determined as announced by the President, which was the 1st of September. We have now decided to bring this forward to today, the 20th of August. The younger adults can, as of today, register and be scheduled, and can also self-schedule for so that they can then, or alternatively, they can also register and just walk into the nearest vaccination site. The option still remains of even just walking into a vaccination site without registration, but this definitely will make you likely to take more time, because it means if you have not self-registered when you arrive at the registration, at the vaccination site, they first have to start with your registration. So we again encourage, especially as we move to the 18 years, who we believe most of them are very familiar with smartphones, with the internet and WhatsApp and other forms of registration. They can easily make sure that they are registered before they go into the vaccination site, which will save time for yourself and also for the staff at the vaccination site. The benefits of opening up early amongst the 18 years and plus is that now we can say all adults for whom the vaccine has been certified, all the vaccines have been certified to be safe, all these adults can now be vaccinated. We can now cut out administrative and bureaucratic red tape, because we don't have, as long as you have an ID, which means you are over 18, you can be registered, almost just like voting. Vaccination at workplaces can take place without the hindrance of age differentiation. In other words, when we reach a workplace, we no more worry about who is over 18 and below 18. Vaccination for travelers, for business or educational purposes will no more require approval for an advanced vaccination. Students at tertiary institutions who number just over 700,000 are now eligible to have a chance to be protected against the COVID-19 pandemic, and also especially against serious illnesses. Pregnant women who are mainly between the age of 18 and 35, it's still possible over 35, but the majority are within this age band, can also get vaccinated and be protected. And lastly, the advantage of this in bringing it almost 11 days early is that we are now able to add a potential 17 million adults into the vaccination pool. This 17 million young adults can now add to contributing to population immunity, which can make us reach the 70% of the adults population, which 70% of adult population will reach when we reach 30 million. Just to remind viewers and listeners that the 40 million we are targeting is as a 70% of the total population. But when you talk about adult population 18 and above, we would reach 70% by reaching 30 million. We have agreed with all provinces that going forward, there must be more focus on taking the vaccine to the people rather than getting people come to the vaccine. Mobile and outreach teams are going to be prioritized. The National Health Department will be working with the Gauteng province, the Eastern Cape, and KwaZulu-Natal to test a model of providing transport from high-density population areas to move people from those high-density population areas to serviced areas, to better serviced areas in the urban areas. Details of this will be provided by the 3 provinces where the trial will be running. In Gauteng, this pilot test will be done transporting, just as an example, transporting people from places like Alexander Township and also Tembisa to places like Galaga Estate in the Midrand, where there is a huge capacity which can take a lot more people. We make an earnest call to the young people who are the future of our country to come forward to vaccinate. Do not be confused by fake news, especially doing rounds in the social media. The possibility of liberating ourselves from the clutches of COVID-19 is now in our hands. We can open up more economic activities, religious, cultural, and sporting activities. Sporting activities with fans in stadiums is a possibility. We have seen that happening in Europe. We can have a better last quarter of 2021, better than 2020. We can have a better Christmas and even a better 2022. All that we need now is to take the first step, which first step is walk into a vaccination site. We once again want to thank our health workers who are saving lives in our health facilities, but also going out into vaccination sites, into those mobile sites, outreach sites. These are our heroes and heroines. We also want to thank the media houses who have come forward offering opportunities to communicate the benefits of saving lives and livelihoods through vaccination. And we're looking forward in the next few days and weeks to working with various media houses to transmit this positive message. Together, we can defeat COVID-19. I thank you.
Thank you, Honorable Minister. Indeed, we are looking forward to welcome the 18 years and above, and we believe that they will not just come alone, but they will come to the vaccination sites with their parents, the uncles, the relatives who are not yet vaccinated, because until they are vaccinated, they will be equally not safe. As you have already announced that we are joined by the survivor today, just to introduce our survivor, Kanya Ndaki. Kanya was a vaccine hesitant until she was victimized by this deadly virus, which landed her in the ICU for weeks before she decided to vaccinate. From a vaccine hesitant, she became a vaccine lobbyist. She's a former health journalist who now became a communicator in the space of HIV and AIDS and TB. Over to you, Kanya.
Thank you, Foster. Good morning, Minister. Good morning, Deputy Minister, and good morning, DG, and good morning to everyone watching. Thank you so much for having me this morning. I'm not an expert. I'm not a scientist. I'm not a doctor. I'm just me, a woman living and loving life. But I wanted to join this briefing today and share my story because I don't want anyone to go through what I went through. So this is why I use every opportunity to talk about my experience, but also to encourage people who are hesitant to come forward and get vaccinated. When I got COVID in December, it was literally 2 days before Christmas. I thought I would be able to manage. Despite having a comorbidity, I still thought somehow I've read all the pamphlets, the WhatsApps, people have been sending me all the remedies, so I thought I'd be able to manage. But by day 5, my oxygen levels had dropped to the low 70s, and my doctor was on holiday. So I was WhatsApping her, and when she found out what my oxygen levels were, she told me that I had to actually rush to hospital. This was, I couldn't stay at home anymore. And I mean, I still was kind of in denial. I thought I can manage, but I was rushed to hospital. And she was frantically trying to get me a bed. I remember sitting in the car parking lot with my sister who drove me there. We both had COVID, and we waited for hours waiting for a bed. because it was December, and hospitals were full, and that's when the panic started setting in. That's when I realized that actually this thing is serious, and I might not make it. So I was admitted, and I went quickly from the medical ward to high care, and then to ICU. And, things were not improving with me. And I remember getting a WhatsApp from my daughter where she simply said, "I think you're going to die." And for me, that was just the most harrowing moment, that my 10-year-old was sitting at home wondering whether I was going to die. And I remember my neighbor in ICU was an old man. We called him Mkulu. And all the nurses, I remember there was just a lot of flurry around my neighbor one day. And then in the afternoon, I remember it was quiet, and I was lying there. And these two men came in. They didn't look like doctors. They came in, and they came to Mkulu's bed, who was my neighbor. And they started talking to him, and they were telling him, "Dad, you've been the best dad ever." And they were saying to him goodbye. They were saying goodbye to him. And that in that moment, I realized that I actually could be next. So ICU was a terrible experience. It was cold. It was lonely. I was disconnected from everything, my family. I was wondering whether my daughter was okay, my mom. And I just wondered whether I was going to make it. I don't think, I remember the nurses telling me, "You've got to actually fight. You're not doing well. Everything is just not, you're not improving. You've got to fight." And I remember lying there just thinking, I'm next. But things did take a turn for the better. I did eventually come out of ICU. And when I did come out of ICU, I was still in hospital for a few more days, but I still was connected to oxygen. So when I was discharged and I went home, I spent almost 6 weeks connected to the oxygen machine. I could barely walk around. I was struggling. I had physio almost every other day, trying to get back to the basics, trying to learn how to breathe again. The road to recovery was long, it was difficult, and it was lonely because I think there was also a certain stigma. People didn't understand that I had recovered from COVID, but people didn't come to see me. It was just my family. And I just remember feeling so afraid, even after recovering from COVID, because just getting back to normal was taking such a long time. And long COVID is something that people talk about, but trying to get up the stairs in my house is still something that's difficult. Trying to take my daughter to school is such an achievement. So I never want anyone to go through what I went through. But funny enough, despite this experience, despite what I went through, I was not really confident. I was not really sure about getting a vaccine. I thought to myself, I've had COVID, I almost died. Why should I bother? What's the point of getting a vaccine? Other people need it more than I do. I thought I'll wait. But then I remember a colleague encouraging me, telling me, you actually have to go, not just for yourself, but for others. And I thought about it. I thought, yes, but I stay home, I put on a mask. So I still held back from going and getting vaccinated. But it was my daughter who actually reminded me about how I nearly died. And I think I used that as a teaching moment for me. And I thought, if the vaccine can prevent me from dying, then I will take it, because I don't want to ever go through that experience again. So for me, I think I don't really have much to say about the science, the facts, the numbers. It's just for me having a chance at living again. That is why I took the vaccine. And that is why I encourage anyone to take the vaccine. You don't want to put your family through what I put my family through. I remember my mom crying, telling me about how she would call. And I remember on New Year's, they were so worried when they were told I'd been moved to ICU. And everyone thought I was not going to make it. So to everyone that's watching today, I mean, I don't have all the answers. I'm not, as I said, I'm not an expert. I'm just me. But get the vaccine. Trust me. Thank you.
Thank you, Ms. Ndaki, for sharing your touching story. This is a story of hope that we believe that those who have listened to you, those who have not yet been in the ICU, will take a vaccine to prevent your situation. Thank you. Just to introduce the next panelist, as the Minister has already said, we are going to be joined by Mr. Michael Fong. Michael Fong is the CEO of George Hospital, situated on the Garden Route of the Western Cape Province. This hospital is one of the hardest hit by the COVID-19 second wave. Like other health facilities, they struggled to cope with an influx of patients, while healthcare workers were feeling the brunt of COVID-19 pandemic, suffering from burnout, exhaustion. Mr. Fong is going to share with us the experience on behalf of other health facility managers on how do they cope as far as managing the admissions, bed capacity is concerned. Over to you, Doc. It's not a doc, it's Mr. Fong.
Hi, good morning. Good morning, Honourable Minister, Deputy Minister, viewers. Can I just confirm, are my slides showing?
Can you do the slide presentation?
Can you see the slides?
Yes. Press F5 on your laptop so that they can, it's not fully visible.
I'm sharing my screen. I'm hoping you can see my slides.
We can see your slides. I think you need to just put it on slideshow.
Okay, it is on slideshow. I'm just going to quickly stop sharing and then escape out of here. But good morning. As I'm talking through you, I just want to thank Haya for that amazing story of telling us about what she's experienced. I think so often what happens in hospitals, the public don't get to hear. Our doors are closed to visitors, and a lot of what the healthcare workers experience and what patients experience are not actually seen or heard by the members of the public. And her story really does talk to exactly what I'd like to be talking about. I'm really just wanting to check my slides, still not sharing in presentation mode.
Michael, I think let's go for it.
If you can press F5 on your laptop, it will take you to slide presentation mode.
Okay, I'm sharing my slides. I'm sorry that they're not in presentation mode. I think I'm just going to continue and maybe just talk as I go. So really just to talk about George Hospital. We're a hospital in the Garden Route in the Southern Cape. I'm going to touch a little bit about some of the data that we see. Really just talk about managing the human resources and the physical resources and the experience at hospital. Talk a little bit about what we experience and also maybe a message of hope. So George Hospital is located in the Western Cape in the Garden Route, largely a rural area, although a number of larger coastal towns. One of the challenges that we have here is we're a long way from Cape Town or other metros. So one of the things we know with COVID-19 patients is that they can't be off oxygen for very long, and even the amount of oxygen we can supply patients on an ambulance means that they can't travel very long distances. So it's really been down to us within the Garden Route as the regional hospital where we provide critical care services, but also our district's hospital to really work together. So in preparing for this, we've had to make major changes to the hospital. We've had to convert more than half of our adult beds to COVID beds. We've gone from a hospital that had 6 ICU beds to going up to 30, creating 24 extra critical care beds. And that just requires a massive amount of staffing resources. And for that, we've really been given as much as we could possibly go. But health services really are reliant on the frontline staff more so than anything. And it's the doctors and nurses where we've often struggled. That has been our constraint in providing services. So we have so much data available. Never before as a hospital manager have we had the amount of data available that we can use and to interpret and to manage our business. This is just an example of the Western Cape COVID-19 dashboard. And the one thing about it, this data is visible to the public. Everybody can see exactly what's happening at any one point in time. But we're also aware that some of this information can just be overwhelming. There is so much information out there, and that's sometimes people perhaps turn off to it or not quite sure what information to look for, or we turn to social media as being our main source as opposed to some recognized sources. This is George Hospital. This is the Garden Route. This is the pattern. This is the waves we talk about. We look at our first wave, our second wave, our third wave, and really what we see here is the number of active cases over time. And the Garden Route starting slightly later than many sites in the Western Cape, but then we were hit with this very intense, sharp rise of a second wave, sort of in November, December, and then really moving into our third wave now, which has been bigger and heavier than what we ever imagined. I think what we could see is that there was very little time for staff to recover between the first and second wave. We closed our COVID ICU for 18 hours. We thought we were just coming to a point where we would have a break. But 18 hours later, we were forced to reopen that to create capacity. So the same pattern that we see in public activity really reflects in hospital admissions, and sort of the experience at George Hospital, you can see, is the same as what happens in the private healthcare. We've got the orange bars, which are showing hospital admissions in the private sector, the blue bars showing what is happening in the public sector. And you can see that pattern is the same. There is no discrimination between who is getting this disease. And really, we try to simplify some of this information. This is just a day in July during our third wave and a snapshot of what we might have been seeing. So at this day, we had 41 staff who were COVID positive. So we're trying to operate our services, but at the same time, large numbers of our staff are sick. On top of that, we would have some staff who've been exposed and in quarantine. We had 89 COVID patients, of whom 24 were in critical care, and that was our maximum. We couldn't take any more. And there we see what's happening in the community, the very real situation of high incidence in the community. Over 1,000 patients per 100,000. So this disease was everywhere. We look at how that worked in the Garden Route, and then as well as in the Western Cape, and we see that George and the Garden Route has been particularly hard hit. So how does this translate sort of on the coalface? Well, sometimes those numbers don't mean so much, but we often talk about oxygen, and that's the one thing that our patients really need to survive. And maybe to give the viewers an indication of how much that's grown is that in the last 30 days, we've used 91 tons of oxygen. That's over 3,000 kilograms per day, a massive increase from what we used to use normally. I never thought I would ever be so excited to see the Afrox truck as I do. It comes to the hospital more often than every 2 days, every 1.5 to 2 days, this truck comes to deliver. these service providers have been outstanding and support us. You know, Vinesh at Afrox, I think, has become our new best friend as he lets us know when the truck is on the way. But the implication for not just frontline staff, there we have on the left-hand side, Rudy, one of our workshop technicians who has to come out at 2 o'clock in the morning sometimes to de-ice the system just because of the amount of this very cold liquid oxygen being vaporized to come to patients. And this is what is happening behind the scenes. This is the story that's not really seen. And obviously there's this massive financial cost to it. So in 1 month, we've spent nearly R1 million on oxygen. From a patient perspective, we talk a lot about COVID, but one of the things I want to mention was non-COVID patients. We've had, because of closing beds, we've had to stop surgery. We've converted our day ward, we've closed theatres. We've used the available beds, and this has a really big knock on non-COVID patients. Patients are waiting for operations. Patients waiting in March last year have had their operations cancelled a number of times. We still make time for the most urgent disease, patients with cancer and other really emergency care, but many patients who are waiting just for normal routine operations, unfortunately, are kept waiting. The one thing I can say is that the teamwork between the clinicians, the nursing staff has just been absolutely outstanding. Daily they're looking to prioritize patients, coordinate beds, who gets where. Just yesterday, there were 16 patients waiting for beds who didn't have beds, and the team would work together, work out which patients they can send home, bring back the next day. It's a daily battle. Perhaps maybe one of the most difficult parts of working in a healthcare hospital has been part of a hospital ethics committee. Now, this committee during the peaks of the pandemic has met daily. Senior doctors, nurses, managers, both doctors on the front line and doctors who specifically are not there working with COVID patients come together. We use a standardized tool to prioritize which patients will get ventilators, which patients will get high flow nasal oxygen. And these are absolutely devastating decisions to make. It's a decision no doctor should ever have to make. And I think what we really do is we take this away from clinicians on the front line. We take these decisions as a team. But that I don't think really necessarily eases the burden of the teams still having to implement the decisions. Sometimes, we're forced to reduce patients to scores, but this really allows us to standardize and show that there's fairness, equity. So if you're a patient in Beaufort West or Mossel Bay or George, you have exactly the same level of access to critical care as one another. So we look to see how we can transfer patients between hospitals to manage our beds as a resource. But this I think is the one thing that has been immensely hard on some of the frontline staff, taking these life and death decisions. And this is why I think we're really grateful for this opportunity to talk today, to tell people about what is happening and really encourage them to get vaccinated, because this is something we really don't want to have to ask healthcare workers to go through again. But there is hope. We celebrate all of our COVID survivors. In our one COVID ward, we have a wall of survivors. Here we have Jacobus and Leah. Leah was on high flow for 10 days, has been discharged. She's survived it, very much like some of the other patients we know, and have wonderful opportunities to just go and spread the news. This is another patient, and I'm conscious of time, but I just would like to play this.
I've got the most incredible respect for these people, for all of the healthcare staff here in George Hospital. All the doctors, all the nurses, even the people that clean the floors, they put their lives at stake, it's an act of love to work there, because they're actually willing to die for if you think of it, to get these people healthy. And they do it every day. Awesome job. I can't thank them enough for. It's It's hard to put into words. I can't thank him enough. Whatever I do won't be enough. That's basically it.
I had the pleasure of interviewing Victor yesterday, and he told us about many experiences, many sad experiences of patients dying dying in beds next to him, but he's maintained that positive attitude and came back to thank staff. A message from our frontline workers.
Most of the people who end up coming to hospital are the ones who aren't vaccinated. We hardly see anyone coming through our doors and ending up in our ICU, even our general wards that have been vaccinated. So we're tired. So we are all emotionally exhausted. So we urge all people outside, please try to keep your mask on, sanitize. If you can, I'll also encourage you guys to get vaccinated. See that if patients are vaccinated, then the severity of the disease is less than when people haven't been vaccinated. So that's why we urge the people to go and get vaccinated and see how it can actually lift the burden of the nursing staff and the doctors and the resources that we've got. Thank you.
We know this message goes to the public, and there's amazing work being done by vaccination teams. And I think the garden route, this is my view that I see driving to work every day. We're very blessed to live in this place, but it's a tourist area, and we know the beaches were closed, and necessarily so there have been restrictions on people traveling, but we really need to be able to restore the livelihoods. We need the tourists to be able to come back to the garden route. We need people to be able to provide jobs. We need our restaurants, we need our tourist industry to survive. And this is really the one thing to do. So yeah, my message, I think, to everybody on behalf of all of the hardworking team, George Hospital, but hospitals across country, this is the one thing we can do as a country. And I thank you.
Thank you, Mr. Fong, for sharing with us the challenges that you go through from the facility. We believe that it's in our hands to relieve this pressure from the hospitals, from our healthcare workers, to protect our families and healthcare workers only by taking a vaccine and stop sharing all this fake news, misinformation that confuses people from taking a vaccine and falling into the trap of anti-vaxxers. Without wasting any time, I'm going to introduce another panelist. It's Dr. Daniel Israel, who is a private clinician or general practitioner whose practice has seen a lot of patients with COVID-19 symptoms, both vaccinated and unvaccinated. He's going to share with us the experience of working with the patients with the COVID-19 and how difficult is it in order to protect himself as a healthcare worker, the practice from becoming an epicenter of COVID-19. Over to you, Dr. Israel.
Thank you, Pastor. Thanks for having me to the Minister, Deputy Minister, DG, and Departments of Health. I'd like to initially just give a little bit of reflection as to how this pandemic has folded out for a lot of GPs across the country. Initially, as we all remember, when COVID-19 hit the shores of South Africa, there was really just a panic as to, how infectious this would be, how dangerous, would people die straight away? I mean, I remember at that point, there was very little data available as to, whether this virus was even airborne. And I remember the panic and people staying at home and not coming and looking after their general health concerns. And I contrast that now to a time where we for months have been able to manage COVID in terms of knowing how it spreads and how it doesn't spread in what I believe is a very safe and effective way. What I do think is very important is to realize to share with you the experience that I've had in, say, the first wave and even second wave, where we didn't have vaccines available, versus the third wave now that we've just had in Gauteng, where we have had many of the patients who have been vaccinated. My practice has seen in excess of 1,500, managed 1,500 patients with COVID. And at the beginning, we saw that the patients not being vaccinated led to quite a high incidence of morbidity and mortality. Whereas in this third wave, although there has still been many patients, I work with a communal organization that manages patients at home with COVID, and we've had a few hundred patients who were vaccinated on this communal program that manages thousands of patients with COVID. But of those a few hundred who had been vaccinated who still got COVID, very few got sick. What I mean by sick is sick enough that they needed to be admitted to hospital or ventilated or even died. I can only think of one patient who was involved with my practice, who had some vaccination, who died in the end, and he had a lot of comorbidities and other problems that really may have been the thing that pushed him over the edge. So it's very important for me to explain that at the beginning of this pandemic, as healthcare workers, we didn't have vaccination. There was a real fear amongst doctors, as there is probably still to some degree because of just the stresses of this time, but of how COVID would affect us and our families and our lives working with COVID patients every day. And since the Sisonke trial, which started months ago, and the initial J&J vaccines, we've really been boosted in terms of being able to help patients and feel more confident that we're protected with reasonable PPE in looking after the patients. Now, I think what's really important also to touch on in this talk is, I'd like to spend a few minutes here focusing really on the average South African mindset as to who does vaccines and who doesn't do vaccines, because I often feel in these forums that we are preaching to the converted. We have lots of people out there who have done the vaccine, and they may join these webinars and watch and out of interest. But there's a big contingency in South Africa of the public who are, I wouldn't call them anti-vaxxers, because they don't have a whole theology and education around anti-vaccination. But they're simply ambivalent and scared about going out to a public place, putting some foreign body into their arm where they feel as though they're young and healthy and can do pretty well on their own. Now, we heard from the survivor of COVID today, from Kanya, about how she wouldn't be considered a high-risk elderly patient, and she still landed up in ICU on, fighting for her life from a COVID perspective, not having been vaccinated. So I think it's important for these few minutes to focus on the people who are probably not even listening to this, but who will not go and vaccinate, irrespective of what we say, and try and understand why they don't vaccinate, so that those of us who understand the importance of vaccination can help promote it and really permeate that mindset a bit more. I wrote an article recently about a German psychologist, Cornelia Boesch, who spoke about a few factors that prevent people from vaccinating. The one she said was confidence in the vaccines. So I think it's important to understand that these vaccines have been through trials. They've been through phase 1, phase 2. There are trials of vaccines, just like any other drug. And if anything, vaccines are tried and tested more than drugs because they are prophylactic measures. You're taking healthy people and giving them a vaccination. So I think the South African mindset for most people have already gone up in terms of the vaccines we have available, confidence in the vaccines, and in the system, which she cited as important. You need to have confidence in the system. And we've seen that as of today, even as of today, any South African adult can go and efficiently get a vaccine in most places of South Africa. We no longer have a problem of supply, but a problem of demand. And we need to make sure that that demand is up. The second is complacency. And this talks to a few of our speakers have spoken. We've just heard about George Hospital. And what's so important there is to understand is that if you're complacent about COVID-19 and you think that it's a virus that affects less than 1% of people seriously and I'm young and healthy and I'll be okay, that's the incorrect mindset. Because if you compare this virus to most viruses and most diseases, the morbidity and the mortality is high. And we all know somebody who's been affected, who's unwell, ongoing. 10% of people will still get ongoing COVID symptoms. We know people who have lost their lives tragically to this pandemic. And so it's important not to be complacent. So that's the second C. There's confidence, complacency. The other one is a calculation, which is a personal calculation of your risk versus benefits of going out and getting a vaccine. The risks of the vaccine are little to none. And I say that with confidence. I still have patients WhatsApping me and contacting me and saying, do you really think I can safely do a vaccine? There have been hardly any adverse effects. I read a report from the CDC on Pfizer vaccines last night that showed a 0.05% adverse reaction rate, of which 91% of those adverse reactions were mild. So if you get a little bit of a sore arm and a headache for a day or two, it will settle. And we have not seen to date people who have long ongoing side effects from vaccines. So once you've done that calculation, we've discussed constraints which she mentioned, and we know that from the South African government's perspective, the constraints thankfully have been lifted well now, and we've managed to secure a great stock of vaccines. And the last C that she mentions is communal responsibility. And I think that this is probably the most important part of this message that I can give, is that we've seen in COVID-19 that the whole onus on the individual in COVID-19 is the responsibility to other people. We've seen that with social distancing, mask wearing, etc. Because even though most people are very mildly affected by COVID-19, every seriously affected person by COVID-19 have it passed on to them from someone else. And this is our not opportunity, our duty and our responsibility to protect other people from getting this virus, because we see that this virus indiscriminately attacks people and puts them into bad positions. So today is a day for South Africans, young South Africans, to be able to go out there and consider the amazing opportunity they have to really be healthline heroes, healthcare heroes. And how so? Because by simply going out and doing a vaccine, you can really make a difference to saving other people's lives and getting our society back on track, where we can do sports and, as the Minister said, social events and really live life again. I often ask the people who are very anxious and not doing vaccines, what is their other option? You know, if they're worried about could the vaccine cause X and Y, which it has shown not to, the question is, would COVID cause a much worse X and Y? And if they choose not to vaccinate, are they going to remain with masks and social distancing ongoing as this virus becomes endemic? I think I'll leave it at there, because it's more important to give the strong messages here. But today is an important day for South Africans to go out there. And if you're part of the crowd that have already been converted, as I said, preaching to the converted, you have an extra responsibility to go out and teach people that vaccines are not some movement or conspiracy. They are a worldwide scientific tool, the most important one we have to overcome COVID-19. I'm hoping the next week will be a huge uptake.
Thank you, Dr. Israel, for your sharing with us your experience and the ways of motivation for people to go out there to vaccinate in numbers, so that we'll be able to relieve pressure from our healthcare system. Now, we are doing well in terms of time. It's almost 20 past. We are going to take questions, and I see we've got very few questions today, unlike as compared with other weeks. But I'm going to quickly go through these questions so that the colleagues will be able to assist in responding. But I see other two questions already been responded. They are no longer on the chat box, but I'm going to read out the others that I've received through other channels. The first question is from Mr. Jonisai Marombo. It reads as follows. My question for the Minister: the issue of complacency is always raised in areas where the infections peak. What are you observing at the moment? Are community members still respecting the regulations as they should? The second question is, other countries, they impose or they introduce the vaccination passport or a proof of a vaccination before you can enter the country. Are there any plans for the country, South Africa, to introduce this requirement before people can travel into the country? The third question is, what is the government strategy to deal with the problem of low uptake of vaccine among men? I'm going to take these questions while I'm still, Let me take the fourth one. I see just came through from Christian Duplessis. from News 24. Do you think the goal to reach the herd immunity will get a boost by the inoculation of the 18 years and above? Do you have any projections in this regard? I'm going to hand over to Minister to lead in terms of responding to questions and assign to the relevant colleagues who are part of this panel. Over to you, Minister.
Thank you very much. I'm trying to get, yeah. Thank you very much, Foster. I'm sure I can share these questions. I'll take one or two. If I can just prepare my colleague there, Deputy Minister Zomo, to be ready to tackle the issue of the low uptake of vaccines amongst men, if you could be ready to tackle that matter. But let me just start with, and then maybe just to share the load. Can I ask first? I'm sure Dr. Nicholas Crisp should be on the platform. I would between him and DG, the issue of the vaccination passport. But let me start in terms of the respect for regulations. There has been definitely a concern in government and also as we interact with various leaders of society that there is in many areas where we go, where you find that people are not wearing the masks as required and expected, but also in terms of social gatherings, including funerals, various indications that from time to time in some of the communities, the respect for the maximum of 50, which is still in the level 3 regulation, is not strictly being adhered to. So I'm sure we often hear of the words COVID fatigue, and these are explanations or excuses which many of our compatriots give quite often when there is no compliance. We would want to again urge all South Africans that it is in our best of interests as individuals, as families, as communities, that we observe this. This is not as a form of punishment, but is a form of protecting our lives and protecting our loved ones and everybody around us. So indeed, there is observation that this does happen, and we really wouldn't want to depend, our society to depend on policy. We know that actually in terms of the disaster management regulations, being in the public without a mask, and not just having the mask hanging on your neck, but covering your nose and mouth, is actually a violation of the regulation. But we would not really want our society to depend on the law enforcement, but rather on a social solidarity that we're doing these things to protect ourselves and to protect the people around us. So indeed, this is, I mean, it's understandable that we've been in this more than 1.5 years, going to 2 years now. But as we have said, these are the basic tools which we have in our midst, having added now the additional tool of vaccination. But even when we have been vaccinated, we still have to keep up with this basic non-pharmaceutical interventions, because they have been proven to be effective. I've said that the vaccination passport, Dr. Crisp and maybe DG will take that up. And now in terms of the opening up for the 18 years and above, whether we expect this to help us to reach population immunity. Yes, indeed. Our main focus is indeed to say that the adult population, where most of the vaccines in their approvals by the regulators have been proven to be safe and efficient for adults, that is 18 years and above. There are already some trials to look at efficacy for children below the age of 18. In some countries, we know that there's already vaccinations of 12 years and above. But what is overall proven and tested and approved by regulators is for adults 18 years and above. So we hope that with the opening up, as I've said, the potential population in the 18 years and above in South Africa is plus minus 17 million. And for us to reach 70 million of the adult population of 18 plus, which is just about 40 million, it means we need to reach just over 30 million people covered by the vaccination. So if we have a significant uptake, hopefully above 70% from the younger population, we indeed can reach the population immunity. So we will be working very hard to encourage our young people to join and also bring their parents and the grandparents as they come to the vaccination, so that all of us can have the potential to recover our lives, social, economic, cultural, and sporting, and have a full life once we have this population immunity. Thank you very much, Foster. We can ask the other colleagues to deal with the vaccination passport issue, and also the Deputy Minister on encouraging men. Thank you.
Thank you very much, Minister, and good morning to Deputy Minister, DG and colleagues, and to everybody who's watching. But yeah, the question of vaccine passports is a vexed issue. There are benefits and there are a lot of challenges and ethical issues. So obviously the benefits of both passes and passports are that during lockdowns, we would be able to identify who the people are who've been vaccinated, and broader society could benefit from these immune individuals being identified. We might get back to a normal life with gradual reopening of the economy. So there are definitely benefits, but there are lots of challenges. Besides the possible infringement of civil rights, we have seen in parts of the world unfair discrimination and exclusion of people in societies because of their lack of access to vaccinations. We have seen that there's uncertainty in the duration of the protection from a vaccine. So if we issue a vaccination pass or a passport, there's no guarantee that person will still be protected and that the passport has any validity whatsoever. Also, in a world where we have been up till now with scarcity of supply, and I'm not talking just about South Africa, but talking generally across the world, it means that there's a pretty unfair distribution of vaccines and a pretty unfair way of excluding certain people just because they haven't been able to get the vaccine. And for example, in our country, where we have prioritized certain groups, we would have had to exclude from passports everybody under the age of 35 up until today. And that would have meant that portion of the population is unfairly discriminated against deliberately by a policy. There's also questions of infringement of privacy. There's the possibility of fraud of these systems. We've seen the sale of digital passports all over the world and hacking into systems and fraudulent creation of these digital certificates and digital passports. So it's not an easy decision. We work in the globe. We're not an isolated player in the world. We are working as very much as part of the Africa bloc with the African Union, and we don't want to do things that ostracize us from our neighbors. But at the same time, we do want to participate in the global space. So we are, at this stage, are doing what some other countries are doing and informing other countries of what our vaccination records look like, so that and appealing them to recognize that we do have a good recording system and we can account for all the vaccines of people without at this stage issuing a vaccination passport. That's not to say at some point it won't become either viable or an implemented policy, but that's an evolving discussion and process. Thank you.
Thank you very much. Good morning to the Minister and to our fellow panelists and to our...
All right, we're going to come out of this briefing for just a moment. We just heard from Dr. Nicholas Crisp giving an update on what is many people calling the COVID vaccine passport. A lot of questions being asked. Why is this coming in now, particularly around employees as well? But what we're hearing is some good news as far as 18-year-olds. Those registrations have taken place and you can actually get your vaccinations from today. We're calling them, and so is the Health Minister, calling them the TikTok generation.
Yeah, I heard that as well. But also that milestone, 10 million mark being reached for vaccination. I'm sure it's quite a milestone so far for government, but also increasingly worryingly, we're seeing that 18.2% increase